Good evening, everyone. It's my pleasure to welcome you to the Larner College of Medicine's second online town hall. When we met 3 weeks ago, we were worried about a nationwide surge in cases that could overwhelm our healthcare system. With physical distancing and nearly universal lockdown, a major surge has been avoided almost everywhere, certainly here in Vermont. Congratulations on doing your part. I should emphasize that even though we did not experience the surge we feared, our frontline doctors, nurses, and other support staff in the UVM Health Network overcame significant risk for their own personal health and for that of their loved ones by coming to work each day and caring for those affected by COVID-19. We owe them a debt of gratitude. Even as we better handle this disease, and it's not over yet by any means, the economic fallout of this pandemic has become more evident. Since mid-March, a record 26.5 million Americans have filed for jobless benefits. It's estimated that unemployment will reach 16% later this year. The economic situation is having a profound effect on our university and the College of Medicine as well. Although this evening we are not focusing on finances, I want you to know that leadership in the College of Medicine is working closely with the university as we determine how we move forward in an environment of previously unimaginable financial pressures. Now, recovery from this economic crisis can only occur with resumption of activities. Here at the College of Medicine, we're preparing for eventual return to clinical care, education, and research. I don't claim to have all the answers, but it's clear that this needs to be done carefully, with primary emphasis on the health of the nation, all the while acknowledging the financial toll. You'll hear more about plans to eventually resume our activities from our senior associate deans in a few minutes. Over the last 3 weeks, I continued to be impressed by the acts of kindness and sacrifice we have all witnessed, with people stepping up and supporting those in need. Last time I enumerated multiple examples of the students, staff, and faculty of our college doing their part in many ways. One further example I'd like to highlight this evening is that the Larner College of Medicine, for the first time in our nearly 200 years, graduated 49 students 1 month early based on their desire to become doctors and add to the physician workforce during this pandemic as soon as possible. Even though the need for their early service, quite fortunately, has passed, we should acknowledge them and the 95 nurses who were approved by the UVM Faculty Senate and President Caramella on Monday of just this last week. Now, before I continue, I must make note of a profoundly upsetting event that occurred in our community. As many of you are aware, on April 17th, an assistant professor of surgery and emergency medicine was arrested after a camera was found in the bathroom off a staff lounge in the emergency department. As it turned out, that lounge was not only used by staff, but also by others, including our medical students and even undergraduate students. While the case is under investigation, that individual is on leave from the College of Medicine and the medical group. The charges represent a horrible act of betrayal. One might ask how such an unthinkable act could occur here. What I can tell you is I've been at a number of excellent institutions in my career, and I've seen bad things happen at every one. This event does not define the Larner College of Medicine. What defines us is how we respond. Dean Gsella and I are receiving advice in our communications and response from a potential victim who has come forward to assist us in this process. This case is being handled by the Chittenden Unit for Special Investigations, a well-respected multidisciplinary organization that specializes in serious sexual offenses. I will be as open with the community as possible and have made sure that those affected can reach out to the victim's advocate at the Burlington Police Department and even the detective responsible for this case. But as I said, we cannot let that event define us, and as such, we will move on with our town hall. This evening, you will hear from senior leaders in clinical care, research, and education. You will also hear from our own Jason Bates presenting his research and development on the Vermontilator. At the end, we will take questions. But first, we're fortunate to have with us this evening Suresh Caramella, the 27th president of the University of Vermont. Since his arrival in July, President Caramella has had a tremendously positive impact on the entire university in many ways. While I know he never imagined this pandemic would occur during his first year, we are fortunate to have him at the helm. Please join me in welcoming President Suresh Caramella.
Thank you so much, Dean Page. I'm very pleased to join your town hall. I must say that I'd much rather be joining this town hall if it was in Hall Gallery or something and see people in person, but that will come, that time will come. And in the meantime, I think we'll make do with this town hall. Thank you for the opportunity to participate. These are the times when community and the connection it brings are especially important. My sincere thanks to all of you, faculty, staff, students. One thing the current pandemic crisis has made clear to everyone around the world is the importance of the medical profession. Doctors, teachers, students on the path to becoming doctors, staff who support those medical students, custodial staff, we're all in your debt. I understand, and Dean Page just mentioned this, that 49 of our students ready to head into residencies have opted to graduate early on April 20th, so you could begin your service on an accelerated time frame without fanfare, but with dedication to our communities. Congratulations to all the graduating students in Elcom. With so many of you doing so much, I hesitate to draw attention to anyone in particular, but I would like to highlight just a few things with the note that I think they're indicative of the incredible work that's taking place in our medical school. First, the work of Jason Bates and his team on what's become known as the Vermontilator. I keep thinking of a Godzilla-like thing, but I think it's a much simpler device. I'm a mechanical engineer, so I get excited about things like this. This innovation has drawn national attention. The story on UVM's website alone has been viewed 61,000 times. More importantly, of course, it has the potential to save lives, lots of them. And I know you're doing all you can to secure production approvals. We're here to provide whatever support we can. You will hear from Jason Bates a little later today. So, of course, as you know, Vermont has one of the highest rates in the nation of COVID tests per million people. And that's in large part due to the work of you and your teams. I believe Deborah Leonard and Beth Kirkpatrick and your teams have been producing something on the order of 5,000 tests a week. Not only will this help curb infections, it will also help to save businesses and the people they employ as we look to reopen the state in a way that's safe and intentional. I'm proud of how Vermont has handled this and your role in it. Many other efforts, from the collection of much needed PPE from closed dental offices, nail salons, and other businesses to help nursing home residents get through their isolation by providing activities such as virtual sing-alongs, are testament to the strength and compassion of the Larner community. Thank you. In a bit of news about UVM, our leadership team and I have worked diligently to keep you all posted with information that is as clear and reliable as possible at any given time. None of us were trained for something quite so sudden, devastating, and pervasive in scope. We have benefited from consultation with Dean Page, Associate Dean Jensen, and many of your public health and medical faculty in arriving at our decisions. As you know, summer classes at UVM are all going to be online, but we've enhanced and expanded our offerings, and I'm quite excited about that. We expect to open in fall, and our UVM Strong Fall 2020 Advisory Committee that I'd written to you about is engaged in careful and intense planning with two goals in mind: safeguard the health and welfare of our community and continue to fulfill our mission with energy and dedication. We will prepare for an in-person campus in a way that is responsible and informed by the best science and by our public health experts. They will require this in-person campus will require more testing, tracing, improved protocols, and additional precautions on campus, in our classrooms, our residence halls, and our dining facilities. We have several months to plan, and we're preparing in advance this time, unlike the first time we had no notice. In closing, I hope that when you drive past the blue lights illuminating the Davis Center, it reminds you of how very much we appreciate your work and how very proud we are of all you're doing. Thank you very much. And if there's time, Dean Page, I'm happy to take a question or two.
Thank you very much, President Caramella. I should remind people that questions can be posed at town.hall@med.uvm.edu. That's town.hall@med.uvm.edu. There was one question that I was hoping you might be able to answer, because otherwise I was going to say that I'd be asking the president. And this comes from a staff member. Do we have any idea how long we will be working remotely? For example, if the governor lets the stay home, stay safe policy expire on May 15th, will we be back on campus for work Monday, May 18th? Or do you anticipate a more phased approach to bring us back to campus?
Yeah, thank you, Rick. I think it's a great question. And the person who asked should be reassured that we will only do what is good for our community. We obviously follow the governor's advice and the rules. We will follow them all. But in terms of reopening, just because we have permission to do so, we will do it at our pace that is appropriate and correct. I can imagine, to the specific question, that if there is a date certain that the orders are completely relaxed, we would at least need a few days to plan it. So it won't be, announced at midnight and put in place the next morning. And I say this only partly in jest, that I will also defer to my boss, Dr. Jan Carney, who has been such a source of support and expertise to not only me and the rest of our community, but to the governor, to the Department of Health. And she's just one person. There's, Louis First is on TV advising children and parents. And so many of you are helping with this. So I will follow what science tells us. We will follow what public health experts tell us. But of course, we will comply with the governor's orders the best we can.
Great. Thank you very much. I'm looking for any other questions that have arrived. And seeing none, I want to thank you so much for joining us. I hope this won't be the last time that you visit with us. I know it won't be. You're certainly welcome to stay, but I know you have other obligations. But on behalf of the Larner College of Medicine, I really appreciate your willingness to come visit with us, and we look forward to doing so in person sometime in the future. Thank you so much.
Thank you very much, Dean Page. Good luck.
Thank you. So next, we're going to hear from our 3 senior associate deans. First, we're going to be hearing from Dean Krysta Gsella, Senior Associate Dean for Medical Education, to provide a further update on where we are in terms of our education for our 4 classes of medical students. Welcome, Dean Gsella.
Thank you, Dean Page, and thank you to everyone joining us this evening for tonight's discussion. Soon you will be hearing about the re-entry of patient care from Dr. Claude Deschamps. And as we begin to turn our attention to re-entry of patient care, we also need to address our academic mission and the re-entry of our learners into the clinical environment. Providing excellent clinical care in our community includes our learners and educating the future healthcare workforce. For me, in my role as Senior Associate Dean for Medical Education, the focus is on re-entry of our medical students. However, it's equally important to plan for the re-entry of our nursing students, pharmacy students, respiratory therapists, and other learners that are so important to our healthcare delivery infrastructure. We recognize the current stress everyone is under, and although including learners in the re-entry of patient care may feel like an additional challenge, it is also incredibly rewarding and important to our core missions. Decisions about the timing and process for re-entry of learners are being made in collaboration with national guidelines, public health and safety considerations, and faculty leadership at our clinical affiliate sites. Our goal is to provide students the necessary clinical experiences as soon as possible. In the meantime, we are working hard to ensure all students receive the medical education they deserve and continue to complete curricular requirements necessary for their medical degree so they can graduate on time. Currently, our faculty and staff, under the leadership of Dr. Lounsbury, Dr. Moore, Dr. Everett, Dr. Eldekar-Hein, and Dr. Kate Nicholas, have identified creative and innovative ways to deliver non-clinical experiences until the clinical environment and the personal protection resources can accommodate our learners. A medical education contingency planning task force led by Dr. Katie Huggett, director of the Teaching Academy, was also developed to look at best, worst, and most likely case scenarios to provide flexibility based on the clinical environment for reentry of our students. Input from Martha Seagrave from Family Medicine, Dr. Molly Rideout from Pediatrics, Dr. John Rosen from Connecticut and representing internal medicine, and Dr. Jesse Moore from surgery, and Dr. Elise Everett from OB gynecology have been instrumental in addressing the concerns and identifying opportunities. I think it's also important to recognize that we are not alone. Every community and every medical school is experiencing the same unprecedented challenges. The National Medical Education Conversations address the impacts this will have on the residency application process, national certification exams, clinical experiences, in-class experiences, student health and well-being, and community culture. And there are many remaining unknowns, such as will the application timeline be changed for residency? Will away rotations be allowed? Will residency and medical school interviews happen in person or remotely? Will there be a spot for me to take my USMLE exam? Or will in-person classes resume in the fall? Although we do not have the answers, I can assure you that all of these issues and many more are being addressed, and we are communicating updates through our website, weekly emails, and town halls such as this in an effort to keep you, our community, informed. I believe there are opportunities as a result of this pandemic as well. The opportunity to come together as a community to address the situation. The opportunity for renewed emphasis on addressing health disparities and inequities. The opportunity for telehealth education. And the opportunity to revisit our way of doing things and where we can be better. So thank you for all that you are doing to support our clinical, academic, and research missions. And thank you for the opportunity to provide you with updates about our medical education program. Dean Page, that completes my presentation, and I would be happy to take questions during the Q&A later.
Thank you very much, Dean Gsella. Our next speaker is Dr. Claude Deschamps, who is both Senior Associate Dean for Clinical Affairs and President of the UVM Health Network Medical Group. Please welcome Dr. Claude Deschamps.
Thank you, Dean Page. Good evening, everyone. It is a pleasure to be here with you tonight. I would like to discuss mainly our re-entry and the expansion of our clinical services. It is now almost certain that we are past the peak of the surge and within our network capacity to manage it. To give you the most recent numbers, this morning there was 8 patients that were COVID positive in our medical centers across the network for both states. That was down from 10 yesterday. In the last 4 days, the incidence of new cases in Vermont have been 9, 9, 3, and 7 cases. To put that in perspective, there have been so far since the beginning of the crisis, 862 Vermont positive test results. Unfortunately, 47 Vermont deaths, but no deaths in the last 5 days, and there's now no patient on a ventilator in Vermont. I was asked by Dr. John Bromstead, the network CEO, to chair a task force who worked hard and fast in the last week and wrote guiding principles that will help shape the reopening and expansions of our clinical services. These include, the guiding principle include that we will function as a network, that we are concerned about our patients whose non-urgent conditions may have progressed to urgent status today, that we are concerned about our providers and our learners and want to make sure that they are protected when they do their job and that they feel safe at all times. We want to resume clinical learning as soon as possible. That also include being mindful of the providers who are older, that are immunosuppressed, pregnant, or have other comorbidities that make them vulnerable during their work. In order to provide the best care, we also need to regain our financial footing. We will need a strong communication plan for our providers and learner. Hopefully, you will see this town hall as a demonstration of that, and doing everything within our means to reassure our population, our patients, their families, that it is safe to see our providers and to come to the clinics and the hospitals in our network. Planning will be based on the best science and the National Society's recommendation and the reality on the ground at every site, including government regulation. Reopening is likely to be more complex than the surge planning. We will need to recognize the pressure to expand our services and the associated anxiety. There are several issues to consider. The cadence of reopening, the coordination of all the efforts, the gradual progression from ambulatory site to opening the hospital, surgery, and intervention area. The testing, like President Caramella was mentioning, Dr. Leonard's team is now able to do close to 1,000 case testing a day, shooting for up to 2,000 a day, as we hope. This is still a work in progress, but we hope to test most patients that will be seen in our network in the next weeks and months. PPE, it has been a challenge, but Mr. Michelli at the Medical Center has worked day and night to get the proper equipment to protect our workers and our patients. The availability of other supplies and pharmaceutical is very important to proceed in a good way in our reentry. We will need to do contract tracing when an outbreak occurs. We will need to continue monitoring of the disease in our population and its communities. Vulnerable areas in our community include the elderly, nursing home, and detention center, jails, and prisons. We operate across 2 states with 2 sets of rule, regulation, government issue, which affect our respective sites differently. And we have to figure out, and we have, how we would deal with the second surge. As we emerge on the other side, there is a strong sense and hope that our reality will be quite different going forward in the following ways. The technology with an accent on telemedicine and remote monitoring. How providers will get compensated will be different. A work week will also likely to be different. And hopefully, this will accelerate our population health efforts. I will finish with an expression of gratitude. I am grateful for all that our faculty physicians do every day in the ICU, in the OR, in the ED, in the wards, and in the outpatient clinic. However, today I'm particularly grateful for the work done by the divisions of General Internal Medicine under Dr. Jan Gilway, the Division of Geriatric under Dr. Mike Lamantia, and the Division of Palliative Care under Rob Gramling. They went out of their way to help patients at Birchwood Nursing Home, a community nursing home here. And thank you so much. You have made a huge difference in the life of the patients and of the providers that were overwhelmed at that nursing home. Dean Page, that completes my presentation. I'll be happy to answer questions. Thank you.
Thank you very much, Dean Deschamps. Our third report is from Senior Associate Dean Gordon Jensen, who's going to give an update on research and our graduate programs and postdoctoral programs within the Larner College of Medicine. Please join me in welcoming Dean Gordon Jensen.
Well, thank you, Dean Page, and good evening, everyone. Thank you for joining us for this town hall. I'm going to touch on a few things this evening, and in particular, I do want to also bring some very positive news. In recent weeks, we had shared that we had developed a new medical student research fellowship program, and that we were making that available for the first time this year. And this is a program whereby students will, after completing their third year, will spend their fourth year fully committed to research training with one of our faculty members, and then return to medical school after that. And we've actually awarded our first two fellowship recipients, and they are Jennifer Holland, who will be working with her mentor, Valerie Harder, and Jordan Munger, who will be working with his mentor, Neil Zakai. So we're really very excited about this fellowship program. We think it'll be a very special opportunity for some of our students, and we can't wait to see some of the exciting research accomplishments of our medical students. Next area that I wanted to touch on was a brief update about all our COVID-19 research activities. 2 weeks ago, we disseminated a red cap survey throughout the college to our faculty, and specifically investigators engaged in COVID-19 research activities. At this point, we've identified more than 45 research projects, truly an amazing surge in research activity in various stages of development. Some of these are quite advanced. They're already actively accruing patients. They've already been through the IRB. There are already federal funding applications going in for some of these projects. And of course, you're going to hear about a particularly exciting project this evening from Dr. Jason Bates later. We've scrutinized these surveys with an eye towards aligning our resources with access to patients, samples, and development of biorepositories. As I've said previously, we have a relatively modest number of cases, and we can't have a dozen investors approaching a half dozen patients all wanting to draw blood from them. Similarly, we have a number of teams interested in developing biorepositories of samples from COVID-19 patients, and we're looking to do that collaboratively as well. So we're already connecting investigators to embark on collaborative opportunities. So a lot of exciting work going on there. One of the next developments I wanted to tell you about is that we are gearing up to have a research slam via Zoom on COVID-19 projects from investigators here, and that will be held May 7th from 10 in the morning to 11:45. Dr. Beth Kirkpatrick's personnel are putting this together, but feel free to reach out to me if you have interest in this particular initiative. It's really going to be a great collaborative opportunity with a series of brief research presentations by multiple faculty investigators here at the Larner College. Lastly, I want to touch on a topic that has been of tremendous interest to our investigators, and that is planning for reopening. We have a UVM campus-wide working group being led by the new Vice President for Research, Kirk Dombrowski, and includes representatives from across the UVM campus. Also includes Dr. Jan Carney, Dr. Beth Kirkpatrick, and myself. And that group is already meeting, and I'll talk about some of the progress with that in a moment. I'm also chairing another working group that is a reopening for clinical research group for the health network that we are meeting just this next week. And we have a strong group of colleagues put together for that, and I'm working closely with Claude Deschamps in that regard. And what will be nice about this is we can align some of the research opening activities between the institutions in that fashion. And I'm looking forward to moving that forward. So what has come out of the UVM working group to date is moving ahead quickly. And I do want to say that we are hopeful that we'll be in a position to provide guidance in 2 weeks' time, and we'll talk a little bit about how that will be disseminated. There's been tremendous interest of investigators. I mean, there's not a day that goes by that I don't get phone calls or emails saying, are we ready to open tomorrow? What do we need to do? And of course, part of this is that it's a university-wide initiative, and then also the entire health network. So the planning has begun. As you heard from President Caramella, the opening of the research laboratories and clinical research is likely to be a phased reopening. We're not going to just throw the doors open and everybody run in. And clearly it is about being safe and appropriate. As President Caramella suggested, we can't say that this is going to happen in 1 week, in 2 weeks, could be longer. It really is going to depend on careful planning and a staged approach. The plan is for the UVM working group in terms of the laboratories is to provide overall guidance for labs and research common areas. And the primary focus is going to be on safety. There will be a systematic communication plan when this guidance is ready to roll out that would include, multiple domains, obviously electronic media, town halls, everything else we can do, Zoom meetings with departments, which I'm already beginning to do. So we'll try to reach everybody in a timely fashion as quickly as we possibly can in a safe and appropriate manner. The overall guidance with its focus on safety will include distancing, masking, staggered scheduling, cleaning guidelines, all these things that will be appropriate to implement a safe staged opening to our laboratories. The plan will be as guidance rolls out, each lab director will be expected to formulate a detailed written plan for opening their laboratory in alignment with the guidance that we disseminate. And then that will be submitted to their department head and approved by the department head and also by the senior associate dean for research. Another step that we're going to do and is in development is as stipulated by Governor Scott, there will be a required safety training that will be available online, and we're gearing up to do that and to track completion of that training. And again, that's coming from the governor. So that's a quick update. A lot of things are happening, a lot of good things are happening, and most importantly, we are carefully planning for a safe and appropriate reopening, and we hope to do it as quickly as we possibly can. And I thank you for your attention. I look forward to answering some of your questions during the question and answer period. Have a good evening. And back to Dean Page.
Thank you very much, Dean Jensen, and thank you for adding a sense of style with your bow tie this evening. Speaking of style, our next presenter, Dr. Jason Bates, is a professor of medicine and biomedical engineering here at the University of Vermont in the Larner College of Medicine. He's been studying the mechanics of artificial respiration and ventilation and ventilators for years. I don't think he ever imagined he'd get the kind of attention that he's received through the press and really throughout the world for his work, which is truly innovative and something as President Caramella mentioned, we can all be proud of. So it's really a pleasure for me now to introduce Dr. Jason Bates, who's going to talk about his innovative ventilator nicknamed the Vermontilator. Dr. Bates.
Thank you very much, Dean Page. I'm going to now share my screen and let me do this. Hopefully everybody can see that, and I will start my presentation. So yes, indeed, I certainly did not expect to be in this position, and I am very honored to be able to address you tonight, and very pleased to be able to bring you up to date with the progress of the Vermontilator, which has turned out to be an extraordinary experience for me, and something that is very rewarding, even though it was born of necessity and not the best type of circumstance. Before I talk about the Vermontilator specifically, though, I'd like to say a few words about the problem that we're trying to solve. Because on the face of it, of course, it's making ventilators cheaply and in large numbers to deal with the possible shortfall. But ventilating a patient with COVID-19 disease when they go into respiratory failure isn't simply a matter of just inflating their lungs every so often. You have to be careful how you do it, because the stresses and strains of mechanical ventilation can themselves be extremely damaging, giving rise to a phenomenon known as ventilator-induced lung injury, which can be fatal. And as Dean Page said, I've been studying this for quite a long time, mostly myself in mouse models. So the kind of mode of mechanical ventilation that we apply is something called airway pressure release ventilation, or APRV. And it's very simple to understand. The ventilator cycles between an extended high pressure, P high, for a duration T high, and very brief low pressures, T low, which are actually atmospheric pressure, cycling between inspiration and expiration, but kind of with the reverse duty cycle of normal respiration, where expiration is a lot longer than inspiration. And most especially, the duration of expiration is brief, in the order of half a second. Now, why does that matter? Well, it turns out that what goes on in a soggy lung when you ventilate it for a while is that it de-recruits. Regions of the lung will close down and then have to be peeled apart again during the next inspiration. And this can be seen if you give a deep breath and then open up the lung and then ventilate it for a while. A normal lung will show a slight increase in stiffness over time. But an injured lung will show a much greater and progressive increase in stiffness, sort of idealized like this. Here's some real data from the lab. It was collected by Gsella in the last decade. And what you see in the lower traces here is the sort of changes in lung elastance following a recruitment maneuver that you get in normal mice. But in severely injured mice, shown in the open triangles, you get a much accentuated and rapid increase in elastance, which corresponds to the regions of the lung closing down. Now, if you look at the time scale of airway pressure release ventilation, you can see that the very brief durations of expiration that follow from recruiting the lung down to this point never give the lung enough time to de-recruit or close down to any extent before they're opened up again by the next inspiration. And what this does is it avoids the very damaging process of reopening the lung with every breath. So, and this is something I've been studying for quite some time. So with that kind of background and having thought about these things for a while, I was very intrigued when on Friday the 13th of March, I got a text from my colleague, Matt Kinsey, quoting Josh Farkas, who was attending on the first ventilated COVID-19 patient at the medical center, saying APRV is the bomb for COVID. That was Josh's exact phrase, meaning that he'd tried this and found that it worked very well. So I was mulling this over that weekend, and I came up with a simple notion for how to deliver APRV in what I thought was potentially a very simple and cheap way, using a rotating valve. A couple of days later, Jake Cattell, who is an engineer at the instrumentation and modeling facility, got in touch with me about potentially working on emergency ventilators, so I sent him my design. He gave it to his colleague, Carl Silver, who contacted me 2 days later saying he had a video of a working prototype he'd made. suddenly I'm really interested because I realized with these guys on board, we might actually be able to do something. So that was the simple design I showed them, just showing a rotating valve with a couple of holes in it. This was the picture of the device that Carl showed me. He was ventilating a rubber glove with a circular system here that was going around just as I'd imagined it, but he actually had a motor driving this thing. And when I saw this glove being inflated and deflated, it was doing APRV. So I was pretty astounded. And that was the beginning of what has now grown into a very large scale project involving all sorts of very dedicated people. This is a later prototype that Carl and others made. And if you look there, you can see the inner slot in the inner rotating vein is just past the outer slot there, which is just post expiration, and this quick lung analog is deflated and just before the lung is inflated. So working prototypes got to a pretty good degree of sophistication. And what we are just about to make, I think probably before the end of the week, there's the waveforms produced, is something that looks like this. This was designed by Jay Cattell, and it's a really pretty snazzy looking device that has an adjustable breath period. There's an alarm on this. There's a safety release valve. This is now ready to be manufactured, and we even come up, my wife and I even came up with a little logo there for this device. So it has gone in a space of not even 6 weeks, I think, from a hazy idea in my mind to something that involves a lot of people, including local manufacturers, of something that could be produced in large quantities and is very well engineered. And we've, about a week ago, we got an emergency use approval application into the FDA, and we're waiting to see how that goes. So the final point I make is that, of course, we have good news about having suppressed the surge, and it looks like what's going on in this state is well within the capacity of our great medical system. But there is a bigger picture here. And just to give you an idea, something that really struck me, was a few days ago, I got an email from someone who works for the World Bank in Central Africa, in the Central African Republic, who'd heard about our project from its news feeds and so forth, who told me that there are only 3 ventilators in that entire country that has 5.5 million people. And there are some countries in Africa that have no ventilators. So we could be looking at attending to a need, not just locally or even in this country, but in fact, other countries of the world that are not nearly as fortunate as we are. So finally, here's the core team of 4 engineers I've been working with who are truly astounding individuals. But it's grown into engineering with UVM grad students, some professional engineers in the local community, all of whom have contacts with this central group of wonderful people. I have, of course, my clinical colleagues, members of the pulmonary division who I work with every day, now remotely. Also, some of the respiratory therapists who are experts in ventilators, and some colleagues across the country, all of whom I'm able to tap into for expert advice anytime I need it. I've had folks help with the regulatory side of things, Renee and Sarah, in terms of the IRB, and Tim King, who is an engineer in Williston with a lot of regulatory experience, who did an enormous amount of work in what turned out to be a 63-page document that we sent to the FDA with all sorts of stuff in it, trying to make it look like we know what we're doing, and hopefully they will give us a good bill of health, and we're waiting to see. We do have some IP that's come out of this. Corinne and Kerry have worked on that with Al, the patent attorney, to take care of that. But our goal here is not to make money. Our goal is to make this widely available as soon as we can to anybody who wants to use it. We have manufacturing across the state now, headed by these individuals, tying in a number of companies that are ready to go to make these things. And we have some MBA students who are looking at the international aspects of this. And finally, I want to acknowledge my wife, Nancy, who's been working alongside me and helping me do all sorts of stuff over the last intense number of weeks. So I just want to say that for me, this has been an extraordinary experience, and everybody on here has just been wonderful. It just shows you what can happen when people get together and organize themselves and respond to an emergency in a way that is needed. So I thank you very much for listening. And with that, I'll hand it back to Dean Page.
Thank you so much, Professor Bates. If you could just stop sharing your screen for us, that's great. Thank you so much. We're now going to take questions. We've got till past. I'll take the first one, and that is about the timing of these town halls. And I want to apologize. It's hard to find a time that will make each group of individuals satisfied, because so many people have different pressures, different timing of their job. The last one was at 7, this one's at 5:30. We plan to have a midday event. When I canvassed people, this was the next best, but it's clear we need to do a midday. One thing that was fairly universal was that mornings didn't work for people. We do want to make these as available as possible. I am gratified. We've had 273 people on the town hall today. I welcome you all. I do apologize for those for whom this doesn't work, and we will plan to make this available online as well. In terms of questions that we have, I'll ask for fairly brief answers, because we've gotten a number in advance and some subsequently for online during the event tonight. For Dean Gsella, question, will students be given more than 2 weeks notice regarding schedule changes so they have time to make and change return plans and ensure proper quarantining on arrival to Vermont? Dean Gsella?
Yeah, that's a great question, and a pretty common one amongst students. We are definitely giving at least 14 days. The goal is to give more than that, obviously, because currently there is still a need for self-isolation for 14 days when returning. We've certainly been optimistic about Vermont's current status. However, it's still worrisome about out-of-state travel. And so our current recommendation is a 14-day self-isolation. So we want to be sure we give students enough time to arrange travel plans. It is a bit minute by minute, day by day, but we're doing our best to give you as much advance notice as possible.
Thank you very much. I now have a question for Dean Jensen. The question is, what will be done, if anything, for graduate students in the College of Medicine whose dissertation research has been significantly impacted and disrupted?
I think this question may have come up also at our town hall with the grad students and postdocs just a week ago. And of course, our response was that we would do everything we can to accommodate this in terms of timing and logistics and support, because obviously there's multiple concerns that go with this, including financial support, including passing the appropriate milestones. My recommendation would be to reach out to Chris Berger, our associate dean, and we can bring whatever personalized support to this that we can possibly bring. But our goal is to try to keep everyone on the appropriate trajectory as best we can. And along with this, we are very much hoping to be able to begin our stage reopening of laboratories in the coming weeks. And again, I can't give you a precise week or date, but that is the plan. And of course, we're working closely with central administration in Waterman to get there. But rest assured, we want to do everything we can to support you.
Thank you very much. The next question is for Dr. Deschamps. Dean Deschamps, how prepared do you feel we are if COVID infection turns out to be a seasonal event?
I think we are well prepared. I hope that it won't be a seasonal event, but I think we are a learning organization. When you look at the speed of the adaptation from almost no preparation, the wave coming in for end of February and mid-March until mid-March, and how we have prepared ourselves, reacted, dealt with the issues, learning from other organizations and from other countries, I think we are well prepared. There are so many things that will need to be resolved over time. The presence of a vaccine, the serology testing, the sophistication of our testing, and the care we give to those patients. So I think we are well prepared.
Thank you very much. Here's a question that I might take, and the comment is about the fact that with this necessity of working at home, staff have proven that they can work home effectively and efficiently. And we put in place support so this can be ongoing. Is it possible, and have any decisions been made in terms of continuing to allow some staff to work at home? I think this is a really important question, and I'd like to find a silver lining for a cloud. And within this just horrible event that we've gone through, for example, I've learned that I can take care of a patient over the phone or with telemedicine almost as well in many cases as if I had the patient come and visit. Now, for some patients, it's a great cost and difficulty to get to the doctor. So some of my care will be provided as an outpatient in the future, I'm sure, using telemetry. Similarly, we've learned that many of us can actually work at home. So no decision has been made. We'll still be expecting the work week as it was, but we need to be open, and this would be individualized as to opportunities for people to work, to think outside the box of simply coming to work every day of the week and not working remotely. It's a great question, and we are learning something here in terms of how to best operate. Here's a question for Dean Jensen. For graduate students, will there be guidelines in terms of operating daily research activities? I think this relates to the current activities and moving forward as the labs start to open up. Dean Jensen?
Right. So we put it, when we closed the laboratories, we put in place criteria for essential personnel and a process for people being designated essentially, and there's a set of criteria that we put out. And if you don't have access to those, goodness, just reach out to us. Bottom line is, for graduate students, one, it obviously requires approval of the mentor for the student. And then there is a simple application that is submitted to Dean Chris Berger, who reviews that, signs off on it, and he keeps me apprised. And we do already have a number of grad students who have that status, who are approved to be back in the laboratories. And that would continue until we begin the staged reopening, at which point there would be more options for graduate students to get back in the laboratories at that point. But as it stands right now, we would continue the process that we currently have in place.
Great, thank you very much. Dean Gsella, here's a question that is particular to medical students. Prometric is currently canceling half of test dates for test takers with no additional dates until August within 300 miles. What is the administration doing to advocate for alternate arrangements which do not disadvantage half of the medical students? Why don't you explain also what Prometric is, so other people listening in will understand?
Yeah, absolutely. So Prometric is an outside organization that contracts to provide various standardized or national certification exams, including the USMLE or the United States Medical Licensing exams. And they are closed. They're closed until May 31st as of right now, and that was an extension from May 1st in the United States and Canada. And the USMLE organization is very aware of this. They have identified USMLE exams as sort of necessary, essential exams that need to be taken during this time. However, Prometrics, again, being an outside contracted organization, hasn't officially agreed necessarily with that. So I encourage students, we had been asked by students to post more information kind of on our website about our view on this. It's really, if we post information, it will be outdated within 12 to 24 hours. So what we do have on our website is a link to the USMLE announcements. And that's on the COVID-19 Med Student webpage. And I really encourage students to just check that. They just posted another announcement yesterday, which says that they're aware of the problem. They have individuals really looking at this closely and are working to identify alternative options, which addresses another question that came in on the chat about schools potentially proctoring exams. And that is something that they are considering. So again, the goal is not to disadvantage students and not give them the opportunity to take these exams. We really have to identify a way that they can sit for these exams in a timely manner. And a lot of people are thinking about that and working on it. There's no solution currently, but it's being looked at, and possibly we as a school would be able to proctor exams. We reached out very early on to ask that, and they weren't ready to consider that at the time. But now that is something they're considering, along with a couple of other options. But the announcements are updated frequently, including one last night. So I encourage students to go to the USMLE webpage announcement link that's on our webpage for med students.
Great, thank you very much. I'll send this to Dean Deschamps, but I can also fill in as well. Dean Deschamps, what is your perspective on students without medical credentials helping out as volunteering during the pandemic? And I imagine that has to do with without medical credentials, but volunteering clinically.
So far, we have been reluctant to have this type of situation happen because we were very concerned about the availability of PPE for other providers and for the patient. So far it has not been possible to allow this, but I'm certain that as time evolves, there will be opportunity for volunteering. But at this time, we have not made provision for this.
Great, and thank you. And isn't it also, for example, in New York City, where things were horrible and they were thought to be getting even worse, in that setting, they were looking for anybody with some clinical experience to be able to help out and extend credentials and opportunities for them to help out in a volunteer way. Thankfully, we haven't reached that point. But again, I think it's credit the medical students that so many were willing to step in. I'll take the next one. I do apologize. We have more questions than we can possibly get to this evening, but I encourage people to reach out to us if we don't get to your questions. The question of, will the Elcom provide hand sanitizer in public areas such as bathrooms? Yes, and the fact is, just before we all were forced to leave, we were changing over from the hand cleanser that was not more than 70% alcohol and therefore was not thought to be able to kill COVID or SARS-CoV-2 virus, and those have been changed out, I believe. So when we get to return, we will be able to allow use of the proper cleaners in the bathrooms as available. There is a question here for Dean Jensen. Will there be guidance forthcoming regarding if or when undergraduate students will be allowed to continue working in research labs? Will this be at the same time research labs will be opened or delayed relative to others?
A very good question. This actually came up at yesterday's meeting of the UVM reopening working group. I anticipate that being a much more cautious reopening in relation to undergraduates. There actually are a few on campus now, and that required dean level approval of both the home department and the home college, as well as the college where the research was potentially being conducted. And in general, until we are more advanced in a phase reopening, which we clearly are not there yet, we're going to hold back probably on taking undergraduates. But it is possible under very select circumstances, and what you'd want to do is have the research mentor reach out directly to the respective dean to have that conversation.
Great, thank you very much. I want to be respectful of people's time this evening. We're just about at our full hour. I want to thank and give a virtual round of applause for the speakers this evening and express my appreciation appreciation to President Caramella for joining us. If we didn't get to your question, please directly reach out to us. These are good questions, and we hope to be able to answer them for you. In closing, these are difficult times, and I recognize the hardship and uncertainty that everyone is experiencing. This is made even more difficult by the physical separation from our social activities. Although I'm amazed at what can happen with Zoom, such as this, Teams, and other programs, we all miss being together. Things will not always be this way, and I look forward to being with you again in person. In the meantime, we need to learn from this experience and apply the lessons going forward. I want to personally thank you all for everything you do in support of our college, and as such, in support of our missions of education, clinical care, and research. Our Larner College of Medicine continues to have a major positive impact on our community, our state, and on the nation. Please take care of yourselves and those around you, and good night.